Hello and welcome. As the number of COVID-19 cases continue to rise across the country, we also have a deadline looming, which is the date that the lockdown will get lifted, and that is May 3rd. Now, the question is, how do we get back to work? How does India get back to work, and what do we need to do? How much do we understand of the spread of the disease today? What is going to likely happen as we open up, for which increasingly we seem to have no choice? And what are the precautions that we can take as we go ahead on that score? I'm joined by someone who brings the right blend of expertise and understanding to have a stab at these questions. I'm now joined by Giridhar R Babu, professor and head of life course epidemiology at the Public Health Foundation of India, and he's worked in the past on stopping polio transmission and initiation, but he's also started off as a All India Institute of Medical Sciences doctor, and then did his PhD at the University of California in Los Angeles. Dr. Babu, thank you very much for joining us.
Thank you, Pratik.
Right. So, Dr. Babu, do you want to start off by telling us what do we and how much do we understand of the progression of coronavirus as of today in India?
So, Pratik, if we follow the trend and you compare it with the rest of the world, India started off really well in terms of having a lower exponential trajectory compared to anywhere else in the world, which means we have by far the lowest number of cases. We also have very few deaths, and the kind of predictions which were, very scary in the beginning, to say that many people will die, we would need lots and lots of ventilators, India is going to be doomed. All these kind of predictions have, turned into sort of something which is not real in nature. However, this is not over. If you look at the way the number of cases are coming in the recent past, it only means that we will continue similar to the rest of the world. However, what we do now, that will determine whether we are able to continue the momentum at a lower exponential, or will it flare up and result in surge of cases. So we are so far really well positioned. It depends on now what we do, how we do, and then how we go into the next few days and few weeks, which will determine what's going to happen in India overall.
Right. This is Govind, by the way. So now, we are, so as we look ahead, we've got one date, that is May 3rd. I'm sitting in Mumbai, where now there is a feeling or a call to push the date from May 3rd to even May 15th. There's no decision, but it looks like it's not going to be as easy. There are other parts of the country where clearly the progression is less, the number of cases are less, where it's likely to be maybe opened up faster. And of course, there's the elephant in the room, which is the economy and livelihoods, and we have to start moving on that. So how are you seeing it, or what would you like to see, or you feel the path should be here on?
Sorry, Govind, I got it wrong in the beginning. So if you look at the overall, even World Health Organization and all the leading organizations are saying a country needs to balance between life and livelihood. So therefore, I'm not an economist, but I only know epidemiology, so I can only speak from an epidemiological perspective. There are others who will have to weigh in terms of their expertise, and the country has to take a holistic perspective. Having said that, if you look at the kind of situation we are in, this is not like India painted in one color. Each state is at a different stage in the disease progression. Some states have just started picking up their epidemic curve. Some states have already well contained. So the action is already at the state level now. So when you take a decision at a national level, let's open up, then you're actually opening the gates from high transmission towards low transmission, from an urban towards a rural. So how do you then think of a situation where you can prevent this? So that's where we say containment is the way forward. So far what we have done is lockdown is a mitigation measure, which means it's like a hide and seek game. We have been hiding from the virus. Now, in this time, we should have actually sought the virus wherever it is present, isolated the people who have the infection, and made sure that it doesn't spread. Uh, we have done that in many states, but we have not been able to do in few states. So those few states are the states of focus now. And
Mhm.
again, there are districts which are very important. Even within a state, there are districts which are silent, which have not reported a case. And there are areas where there is high transmission. So as we think of opening up, all the benefits that we have accrued over the extended lockdown should not be washed away. Otherwise, people will say, why did we go through all this trouble if the cases had to come so many in future? So therefore, we have had gains, but we need to make sure how we move forward. And for that, surveillance is the only way forward. Detect cases, isolate them. Pick up the contacts, quarantine them. Apart from all the other measures of physical distancing, which we can discuss in later, but then this is the key ingredient of how we move forward.
Right. Okay. Now, so let me ask you to wear the hat of a doctor for a moment. I mean, I mean, as a practicing medical doctor, which I know you're not, but why is the disease spreading? For instance, even in the area where I am in the city of Mumbai, we are discovering new cases every day. Now, as far as I know, most of these people have been contained or under lockdown for more than 28 days, which is 2 cycles. Now, obviously, there has been some leakage somewhere, but in general, do you have a sense on why this continues to happen despite the fact that we are now almost 40 days in most parts of the country under a lockdown?
Yeah, I mean, if this could happen during lockdown,
Yeah.
just imagine what happens when you open up and then relax all these measures that we have. I'll
Mhm.
explain you how this spreads. So the disease, which causes by infection of a RNA virus, the incubation period, which means that from the time the virus enters the body till it starts giving symptoms, is the range is around 14 days, roughly 5 to 7 days being the median.
Mhm.
Now, most people in India do not develop symptoms, or they develop symptoms which are very non-specific. So therefore, people might still spreading the disease or infection while they do not have the symptoms. So this is the most, this is the good and bad thing about
Yeah.
this infection. The good thing is that not many people get affected in the sense that they don't have to be hospitalized, they don't need ICU. However, they can continue spreading to people who are vulnerable. So therefore, whatever spread that we see now is because of both symptomatic and asymptomatic people coming in contact with someone else in their close contact or secondary contact, and that's the only way it is spreading. So this virus is spreads through droplets, and these are heavy droplets. It can't go for many meters together, and it's because it's heavy, it will settle down onto the surface or anything that you have in your close vicinity. So as long as you maintain a minimum distance of 1 meter and you're using masks, it should not spread that much. So as a country, both these measures, physical distancing and use of masks, we have started, and we are sort of getting used to do both of these. But if we continue to do that as we move forward, I think we can reduce most of the spread both in the urban and the semi-urban settings.
Right. So you're saying that even as we get out of the lockdown, if we were to follow these two things very judiciously, then we will surely contain the spread of the disease.
Yes.
Right.
Yes.
Okay. Yeah. Okay. So here's the other question. A lot of people want to know. I mean, families with children are either going to schools or colleges or have coming up. Some, of course, are ending the year, but there are others who are starting or close to starting. What is your advice to them? I mean, how should they be looking at this period, and what should they be? Even if, let's say, the school opens on May. I mean, just to catch up, maybe should I send my child to school?
Yeah, so I think that's a very good question. All over the world, Sweden is the only country which has allowed schools to continue. Otherwise, most countries in lockdown phase and beyond, they have shut down the schools.
Mhm.
What we see from the disease itself, children are not affected that much. However, they are the carriers, and they can bring the infection to the elderly and people who are vulnerable otherwise. That doesn't mean that they won't get affected. They might get infected. Some of them might succumb. Therefore, the best thing as we move forward is to continue the new normal, try to have as much as classes through correspondence. If it is video classes are not possible, and if video classes are possible, continue this like work from home, study from home option for some time in future, so that we are in a better position, because there's a lot of research going on vaccine and drugs for repurpose. We hope we are in a better state later on, where we will be able to open up schools and other settings.
Right. So, I mean, and talking about drugs and vaccines, there is a lot of, I mean, I've been talking to a lot of doctors who are administering many medicines, and they're all following the Indian Council of Medical Research guidelines on these medicines, including hydroxychloroquine and antiretrovirals and retrovirals. So what's your sense? I mean, are these medicines, I mean, on balance, are they successful, or are they able to control to the extent that I can have the confidence that I can go out of the into the world if I have no choice, assuming I'm following all the other norms that we've just talked about?
I'll be honest with you, Govind. There's no evidence either in terms of it works or it doesn't work. Whether it does good or bad, we don't know. So, I mean, in science, most of the times we follow evidence and then use it as a reasoning for using any other drugs. So the first thing we learn in pharmacology is poisons given in small doses are drugs, drugs given in large doses are poisons. So therefore, you just cannot, I mean, I'm not saying hydroxychloroquine use is unethical or unjustified. This is based on some case studies and some need expressed. As we speak, there are large trials going on using hydroxychloroquine. I'll wait for the results to see what clear beneficial effect it has. But as of today, I would not have the confidence that a drug or anything that is available there can help us in terms of either reducing the transmission or reducing the severity.
Yeah, and that really was my question, because my question is today that, therefore I need to know, and I think people need to know that essentially they are playing with their lives, because there is no way of saying that it's not like any other disease, except for maybe cancer, where you know that you could get cured. In this case, you are playing with your life if you take chances or you do not follow these precautions.
Yeah, Govind. So I think there are there's a lot of misinformation going around when it comes to this disease. Number one, people are saying that we have a different strain in India, which doesn't affect many people, which doesn't cause severity. That's not true. And I have tried to look at literature. I did not find evidence that from where this kind of news is coming. The second thing is that young people don't get affected. So anyway, we can start going to the offices or schools. This is not true. Again, so, and the third thing, what you said is, are we playing with life? May not be with our lives, because people might be younger and then you might never succumb. But then you'll be playing with the lives of the people who are at home, who are elderly or immunocompromised. And in India, we have many people with coexisting diseases, either 1 in 3 adults has hypertension, 1 in 10 adults have diabetes, type 2 diabetes mellitus. So when you look at a country where the comorbidity is so high, we simply cannot take a chance that, okay, let's move on with our lives and then let the disease run its course. I mean, I really get disturbed when I hear let the disease run its course. Then what is there's no use of public health, there's no use of all these measures that we have taken. So I think we need to be careful. We need not be complacent at this stage. We have had some real good gains compared to anywhere in the world. So let's not waste it.
Right, and finally, this is an ongoing debate now, or it's become a bigger debate. How many people are really carrying this disease? Now, emerging evidence seems to suggest that more people were carrying it from much earlier, and we didn't know, and obviously only testing will let us know. But what's your sense about India itself?
As of now, we are not in a position to clearly say what is the extent of the spread apart from those whom we have tested and found positive. The reason is we have found just in India nearly 70% and above what so-called as asymptomatic. But this asymptomatic comprises of three different groups. The smaller portion, the smallest portion is truly asymptomatic, which means they'll never get any symptoms related to this disease. The next big group is pre-symptomatic, in the sense that we have tested them when they did not have symptoms, but they'll go on to develop symptoms later on. The third group is atypical symptoms. Just yesterday, CDC included 5 more symptoms into the diagnostic criteria. So when you look at all of those, I think we need to widen the kind of symptoms that we screen for, not focus too much on the test per se. Of course, we should expand the testing, but then testing is not the goal by itself. It is just a means. But even before that, we need to be looking at symptoms and making sure that a diagnosis of probable diagnosis is made, and then we start isolating people. So this is the way forward. Whether atypical symptoms or symptoms, by doing this, we should be able to isolate many people with infection. The remaining people who might be spreading because of asymptomatic phase can be prevented by using masks and physical distancing. So that's the new normal now.
Right. And last question, Dr. Babu. So what's your own sense? What's your gut telling you? Are we, as May 3rd comes and goes, do we need to be worried about something much bigger coming? I know we need to be prepared for it, but do we need to be worried about something bigger coming? Or do you think it'll be mostly linear progression in the manner that it's been growing right now, and therefore we will have that ability to control?
We do not know beyond what the data says, but then based on my sense, when the whole thing started playing out in terms of picking up the outbreak in India, when I said we will not have the numbers like the other countries, people who had different modeling said, no, that's not possible. But India took really unprecedented measures in terms of which cannot be matched anywhere in the world. So as we move forward, I'm sure that we will be better than most countries in the world because of the policy direction that the country has taken. But this is the time for responsibility at individual level, at the organization level, when things like work from home should be continued, school managements which have to think innovatively in terms of how to continue this kind of new normal. So if we exercise these responsibilities carefully, I think we will continue at the same lower momentum for some more time till we flatten and then we have some vaccine or a drug. So I am very optimistic about India's progress unless something drastic, some shift occurs in policy or implementation where we lose all the gains. That should not happen.
Hopefully, right. And that's an optimistic note to end on as well. Thank you very much, Dr. Babu, for joining us. And I hope to come back to you in a few weeks and get an update on how things are happening and how you would be looking at the data at that point. Thank you so much.
Sure, Govind. Have a nice day. Bye.
Thank you.